Hi, I'm Walter Hoffhines. I'm running for U.S. Representative for the 32nd District of Texas. Medicare is directly in the path of two problematic trends: an aging population and shrinking worker base, and rapidly escalating health care costs. Over 89% of Americans over age 65 are covered by Medicare. At present, approximately 46 million Americans receive Medicare benefits. By 2020, just 8 years from now, that number is expected to increase to 61 million, with a further increase to 78 million by 2030. Currently, there are approximately 3.7 workers supporting each beneficiary. By 2030, that number will decline to approximately 2.4 workers. As discussed regarding immigration policy, we should encourage immigration to expand the base of active workers in the country and reduce the average age of workers. In addition, investment in infrastructure, education, and research will enhance the productivity of those who are working, increasing the total available resources. These measures alone, however, are unlikely to fully offset the declining worker base. In addition, medical care expenditures are increasing at a rate substantially in excess of that of general inflation and growth in the economy. Total healthcare spending as a percentage of gross domestic product has increased from 6.5% in 1960 to over 17% in 2009 and is expected to reach nearly 20% by 2019. Controlling cost has two elements: the prices we pay and the scope of services provided. Both must be addressed. I address cost in more detail in my general discussion of health care. In the context of both Medicare and care for those under age 65, however, we need to engage in a serious dialogue regarding the scope of services we choose to provide to each other through public funding, and those services that will only be provided if an individual can afford the cost. We may choose as a society to provide unlimited health care of the highest quality to all citizens through public funding. This will be expensive and will require higher taxes. We may choose to limit those services in some way, whether by ability to pay, as we do now, or through an active, intentional balancing of costs and benefits to the individual and society regarding which services will be provided on a publicly funded basis and which will be provided on a privately funded basis. These are extremely difficult questions. There are no easy answers. I would actively engage in an effort to develop such a dialogue toward the end of developing a consensus about what health care services should be provided and how we should provide funding for them. As short-term Medicare cost control strategies, I would support removing the prohibition on government-negotiated drug prices and limiting payments to Medicare Advantage plans to the equivalent cost of the traditional Medicare plan, both of which would provide savings in total program expenses. We're on the wrong path. It is time to stop and set out for the right path, a path of principled use of government for the public good rather than the good of the few. I'm Walter Hoffhines. I'm running for the 32nd Congressional District of Texas. I ask that you join me in working to create more opportunity, a better, more secure quality of life, and a fairer and more just society for us and those who come after us. Please visit my website, sign up for emails, follow on Facebook, and ask others to work with us.